Jenny, we're just going to do one big thing today, and that's it.
Awesome.
All right. So for the Bold Beginnings series, which, by the way, I'm starting to see feedback about online, which is very exciting. People are finding it.
Hopefully it's yay feedback.
Do you think if it was bad feedback, I would have brought it up while we were recording another?
I hope not. Well, you have to give honest feedback. I mean, people would really like to hear a little more about this, or I didn't really agree with that, or whatever. Honesty is important.
That made me laugh. I mean, I would have that conversation. I'm going to be honest in front of people. I would have that conversation with you privately.
People hate us.
Oh my God, I'm getting feedback and really no one likes us. I didn't realize. But the people are finding it useful in the way that we intended. So that's perfect. Very exciting, actually. So today we're going to hit, this one doesn't seem like fun at all. It's a Monday morning, but this one is titled Guilt, Fears, Hope, and Expectations. And there are a lot of
questions or mostly like comments?
Well, let's dig right in and find out.
I'm sure it's both, honestly.
So I think, I don't even want to give my opinion yet. Like, let's just talk. So the first person said that they experienced immediate grief around diagnosis. Just immediately, like a loss had happened. I've talked about this on the podcast before. I've tried to have therapists on to talk about how you manage grief. Because I don't know from a technical standpoint, but it's so strange, isn't it? We just talked about this before we were recording a second ago.
Yes, we did.
Yeah. I guess I'll say it here while we're recording. There is a reaction that you have when you get bad health news, and bad health news that isn't going to get cured. It's not like, wow, you have the flu. Just try not to die for 6 days and you'll be okay again.
Right.
Like that kind of stuff. There was when Arden,
you'll go back to being the tennis pro or whatever.
Yeah, you'll go back to your life. This is all going to be fine. But when Arden was diagnosed, I remember just thinking, oh, well, we're not going to have the life I thought we were going to have. Right. Like, and then over time that you realize that diabetes isn't as difficult as you imagine it's going to be. Hopefully, if you get some things figured out, and that it's not, I don't know, for us at least, it's not like somebody chained Arden to a post and we couldn't get her off again.
Correct.
And, we had to just live our life here in this little space. But it still is true that we're not living the life that, like, when Arden came out and we were like, look, we have a baby, like in our Simba moment, you know what I mean? We were like, yes. We're holding the baby up and on the hill. This is not what I thought was going to happen. And so I think that's the loss. I think I don't know what you think, though, because you were diagnosed at a different time at a different age.
I was, and I don't know that I so much had a sense of loss as a sense of significant change. When I was diagnosed in the hospital, the nurse educator was very quick to tell me I could do mostly anything that I wanted to do. What she told me I couldn't do, she said, was very limited and boiled down to essentially being, I don't know, something like a bus driver, a pilot, and I couldn't be in the military. She's like, so think of all the things that you really like doing and might want to do at this, age that you're at, and realize that you can still do all of these things. And I was like, well, I was not thinking about being a pilot. I wasn't thinking about being a bus driver or, whatever. So I just felt like, okay, I guess I just have to do these additional things. So my personal sense wasn't so much of obviously I didn't feel guilty. I mean, I didn't have anything to feel guilty about. I'd have to ask my mom if she had any guilt or my dad felt any. They'd never voiced it if they did, but that guilt and sense of loss, I hear a lot of that in the families that I work with. And it can stick around.
Yeah. So for me, I was a stay-at-home dad at that point, and we pretty quickly, even though we didn't understand the link between Coxsackie virus and maybe being diagnosed, and even at the moment in the beginning, I didn't understand that Arden had markers that made her more likely to get type 1 I didn't understand any of that at that time.
Right.
But I did see, anecdotally, she was sick. She had this Coxsackie virus, and now she has diabetes. And I beat myself up pretty hard about that because I kept thinking, like, did I not wash her hands? Did I not wash my hands?
Did I expose her some way that could have been prevented?
I kept thinking I took her to the wrong place. Like, did I get in my car one day and drive to this place for lunch instead of that place for lunch? And that's why Arden got Coxsackie virus. And now we're here at this hospital in Virginia. Like, and it's crazy because it's twofold. It's not something you can control. And it's obviously not something you have vision for that you could have not done. But yet there's that part of your brain that goes, if you would have zigged instead of zagged, maybe this didn't happen. And it's hard not to feel that. It's almost like, do you ever have a car accident and think if I would have just left 30 seconds sooner, this wouldn't have happened?
Yes. Absolutely. Right. Yes. I've only ever had one car accident in my life. I was coming home from college and the roads were clear, except you know what black ice is,
Black ice, yes.
So driving home, and instead of taking the highway, I took a road that cut some of my time off. And it was more of like, let's call it a country road, right? I mean, it was paved. It wasn't like weird backcountry or anything, right? But I had this little Renault Alliance. That was my very first car. And the back tires hit this patch that I thought was snow because it was like lightly covered.
Right.
And I dashed like across the other side of the street and across the ditch. I hit a mailbox and I ended up in somebody's backyard.
Wow.
So yes, I did. And at that point I was like, well, had I just like slowed down when I saw that snowy patch in the road, knowing Wisconsin weather and whatever, but you can't go back.
No,
you just have to be like, okay, now I'm more aware at this point.
I realized I yelled black ice out of context. When Kelly and I were very young, she would tell me all the time, be careful of black ice. And one day we were driving and I just started to wiggle the steering wheel and I yelled, black ice. And she panicked. And
no,
there was no back. I'm now wondering.
It was a mean joke.
Yeah, I'm now wondering how we're together. How she didn't just like say like pull over and let me out now, you idiot. So,
I'm done.
It's funny. You were talking about the things that the doctor told you or the educator told you couldn't do. And you're like, oh, no problem. I don't want to be these things anyway. Have you ever heard the lady that came on the show whose husband was a fighter pilot, I think? And the person told her kid when the kid was diagnosed, don't worry, the only thing you can't do is fly a jet.
Yeah.
And it's the only thing the kid wanted to do because his dad does it. And
of course.
I think even in that conversation, the woman's like, that poor lady, like she was like so sure she was going to reinforce to my kid that you can do anything. Look, there's this one simple thing you can't do.
And that's exactly what it was. They wanted to do. I know.
So it takes me into these next couple of statements. People said, I really needed a lot of hope in the early days. And that is what people are trying to do when they say, don't worry, there's only 3 things et cetera, or you'll live a normal life. You just have to count your, I think oddly that so much of the poor management information that people get in the beginning stems from someone trying to be kind to them. Does that make sense?
It does.
Like, don't worry, just count your carbs and do like they're trying to make it seem easy.
Yes.
Right. And maybe that's the only thing you can do in that spot. I don't know.
I would agree. And it especially boils down to the one comment that I think it's hard to understand once you get further into understanding management is the food tide one. You can eat anything, just take your insulin, right? And it's a way to tell somebody not much has to change. Look, you can keep doing everything that you have been doing. You have to just add these little extras into the picture. And there's supposed to be a sense of relief. Like, thank goodness I can keep, eating whatever it was for lunch that I love to eat. But it doesn't take away from the feeling of the additional things that are really big additional things that we're teaching somebody they now have to do.
These next couple of statements, kind of hinge together a little bit. This one person said they kept hoping the doctors were wrong. Like they sent
Yeah.
them home. I hear that a lot from people. I only went through it for a day. And I know Arden had some sort of crazy honeymoon day, which I look back now and think probably wasn't even a honeymoon. She just really just didn't need insulin this one day.
Right.
Right.
Like they were wrong.
And
No, they were wrong.
I called my friend who's her pediatrician. I was like, hey, she hasn't needed insulin all day. I think they're wrong. And he was so sad. He was like, oh, Scott, like she has type 1. He's like, this will change. Like, just keep watching, you know?
Yeah.
And there's that. And there's this other part here. This person said that there was so much confusion in the doctor's office. And looking back, the way she sees it is they weren't 1,000% sure the kid had diabetes, but they were sure. And she said, I just kept seeing the medical people looking at each other and nodding and kind of like talking to each other with their faces, but not saying anything out loud to me. She said she found it very scary, like just in that space.
And scary in terms of, are they confused? Are they actually the right people that I should be talking to?
Mm-hmm.
I mean, really, you don't want a confused look or these exchanges of eye movement, facial expression between what you're thinking is an educated professional,
right,
to get an opinion or a diagnosis from. You just want the direct information.
Yeah. Tell
me what you think it is. What are you going to do to prove that it is or is not this?
Yeah.
Just be honest.
It's super interesting that I'm going to tell you something personal. It has nothing to do with diabetes. My mom's blood pressure started to go up a few days ago. So I get a message from her. Hey, Scott, my blood pressure has been high the last couple of days. I call the nurse where she's living. I'm talking to the nurse. And I said, hey, my mom's blood pressure has been high for 4 days now. What are we doing? And she said, oh, the doctors gave her a little more medication. We're waiting to see if that worked. And I was like, well, what else are we doing? You know, are we just going to keep medicating her until, you know, I was like,
right.
And she says, so I want to get this word for word. She says, well, your mom has a heart condition and those don't get better. They just get worse. And all I could think was, what in the hell are you thinking saying that to me? Like, right. You don't know me. Like, I took it. I was like, yeah, I know. Like, but like, that doesn't mean we're giving up on her, right? Like, she could see the cardiologist, couldn't she? You know? Right. But all I could think afterwards was like, the lack of bedside manner in that statement is fascinating.
Absolutely.
She was like, hey, what do you want us to do? And I was like, right. I was like, what? Something. Could you do something? You know, I just couldn't believe that it occurred to her to speak like that.
Absolutely. And I think what we've lost, actually, not everybody, but I think what there is a loss of in healthcare is a sense of being human, right? It's a sense of, how would I want this presented to me?
Yeah.
Imagine you're the person sitting there. And I think doctors, you know, and or other clinicians, not just doctors in general, but other clinicians have become so very just blunt, for lack of a better word, about this is it. And no, it's not going to get better. Well, you may want that information eventually, and you may actually sort of know that. You may understand that as an adult, especially. Yeah. But to have somebody so very cut and dry be like, nope, this is it. And this isn't going to get any better. I mean, put a little bit of empathy in that rather than just being so, yeah.
Jenny, I don't want her to lie to me, but no. There had to have been a few better ways to say that.
Correct. You know? I mean, even to be able to say, well, we're going to use these types of medications. And as you understand, the medications we may need to titrate, we may need to change them. As things change with this type of a health condition, we do know that it doesn't typically heal. And so we're going to have to try things to keep your mom comfortable, to keep her feeling well enough, but it will progress.
Yeah.
I mean, I think that was much nicer than the way that you're talking.
Yeah, no kidding. I fascinated. Anyway, so there's a balance between being told the truth and being slapped in the face with some horror.
Yes.
There's better ways to talk about. And I don't know.
Right.
There's a
Well, and
mix
I
in
think,
there.
as you say, slapped in the face kind of with a diagnosis, oftentimes in a very emergency type of diagnosis for type 1, many times it's not that somebody's caught symptoms early enough and just come into the peds office or to their typical primary care doctor and say, yeah, I'm not feeling so great. Could we, do some tests and have some discussion and whatever? Many times it's very emergent. And then, like mine, I went to the emergency room and I was right there when the doctor told my mom and myself what was wrong.
Yeah.
There was no like time in a nice room someplace with
Yeah.
like birds outside the window
I'm just saying,
to look at.
just be human. That's all. Like,
Yes.
that's all I'm looking for from anybody. I'm going to read this person's statement. It's pretty big. I felt an incredible grief. We had no family history of diabetes. It was a surprise, and I was extremely scared. On the way from the urgent care to the hospital, following an ambulance that my daughter was in, followed by her ambulance ride, my daughter asked what diabetes was. And she said, I was like, it's sort of like being allergic to sugar and you need shots. I didn't know a lot, she said. She said, I wept all night when she wasn't looking. I thought, I can't do this. I really just can't do this. She said, I wanted someone to come and give me a hug to validate my feelings and my fears, but also to tell me that this was going to be okay, that she could live a great life, and that I would be able to do it. A lot of parents have learned to manage well, and you can too. She said, it would have been great if somebody could have said that to me.
Yeah.
She can still do everything you hope, etc., and so on. I would have liked someone to tell me that the next few days were going to be hard and that it would involve sleep deprivation. It would have felt good to know that I could have done it one step at a time, maybe one day at a time, that I could have found a Facebook group, that I could have shared my struggles with somebody else, that somebody else might have known the difference.
Sure.
Yeah.
And I think some of that also ties into the rapid nature of discharge upon a diagnosis like this. I mean, in today's world, unless there's something really detrimental within that diagnosis and they really have to keep you for many, many, many days, most often it's you might be there 1-2 nights and you are out and you get rapid fire information. First, you get a diagnosis that you had no idea even what it was many times. And now you're getting education, if you will, and you're getting information about all of these things that you're going to have to do. Again, the factors of life changing become like a quick like knock on the head.
Yeah.
Here you go. All these things, when I think that when I was diagnosed, I was in the hospital for an entire week, and day after day, there were new things brought in, different pieces of education in a nature that I could swallow and my parents could swallow because it wasn't all rapid fire.
Yeah. I have a note here from a person that I just randomly got this note a couple of days ago, and it just says, hey, Scott, thanks for everything. You've helped me more in 2 days than anyone else helped me in the last 20 years. And what I responded back to her was, I was like, well, that's really wonderful. Thank you. I appreciate that. I'm glad that the podcast is helping you. But I didn't have to tell you those things while you were sitting in the hospital, and it still felt like somebody hit you in the head with a frying pan. You know, like I got to tell you when you were relaxed and at home. And
I think in a different way, though, like there's a slap in the face with something that you never expected. Again, a type 1 diagnosis or a type 2 diagnosis or, whatever. But then there's a slap in the face kind of with, well, darn, this information's been around. Why didn't I have access to it? Why did nobody told me about this? Nobody told me I could do this way or use this product or whatever. So I think they're similar but different enough that you've been already navigating through something, and now you're a little bit more irritated.
Yeah,
you're like, well, why did nobody tell me this?
Hers has another layer, and that definitely is that, if she would have found the podcast, 6 weeks after she was diagnosed, she'd be like, all right, cool, 6 weeks. I didn't understand what I was doing. 20 years is hard because you start doing that reverse math. You're like, I've done damage to my body now that I can't get out of, and you're telling me this all existed and just no one told me about it.
Right.
So it's a strange balance. How do I explain type 1 diabetes to a 3-year-old.
Mm.
And I mean, I don't know. I don't think you
So
can.
what did you do
right?
with, I mean, Arden was 2, right?
Yeah, she was
How
2.
did you guys talk to her about it?
You look her in the face and you say, I'm sorry. I have to give you this needle. And you try not to cry. I
Yeah.
mean, what else are you going to do? Right. Like she's 2 or 3 years old in this person's situation. Well, what are you going to say? Like,
Correct.
what are they going to understand? Hi,
And
there's,
that's where you have to look at is the understand level.
yeah. I mean, eventually we told her there's a thing inside of her body that makes the stuff inside of this needle. It's not making it anymore, and she needs it. And so we're going to give it to her this way. And she then saw the needle, put a big smile on her face, and ran away from us. She's like, ah, and took off. Because, she just told me 2 nights ago, we were sitting around online Googling what are people's biggest fears and guessing people's top fears, like by state, by country. It was actually kind of interesting.
Yeah.
And she said, oh, this is one of mine. And so we're all like trying to guess what it is. And she's like, needles. She's like, I'm afraid of needles. She's like, I really don't like needles. And I'm going to try to get her on the podcast soon to talk about it. But Arden's only ever given herself 1 shot. 1. And it was
because you did it for such a long time.
And then we
as
switched
a kid
to a
before
pump. And we switched to a pump when she was 4. And she gave herself 1 recently because she's going to school. And I was like, listen, you're going to hit a spot at some point while you're at school where you're going to have to clear something. You're going to need an injection. Here, do this one. And I'll let her tell the story. But she, I think she took the better part of 90 minutes to put the needle in her thigh. Like she had to go into a private room by herself and like psych herself up to do it. But if you take her, she gets blood draws constantly.
Sure.
Hates them, but has to watch it happen.
And somebody else is doing it though.
Yes. But she stares at it. I'm like, Arden, look away. She goes, I need to see it happen. And I'm like, all right. I don't even know how to explain that thing. Right. So, and it's not just as simple as, nobody wants to get stuck with a needle, because nobody wants to get stuck with a needle, but she hates it, but how do you explain it to a 3-year-old? I don't know. Like, I think the best thing I can say is that after a while, it just becomes commonplace, and a 3-year-old doesn't remember 5 months ago, the first day you were like, here, give me your arm,
Right.
We're going to
do this. And as you teach kids anything, I think parents who are very verbal in explanation about, we're going to do this because of this. Like, I'm going to go outside and I'm going to mow the lawn because the lawn is long and it needs to be cut. And, we don't want bugs growing in our backyard or whatever it is. I mean, at a level that a kid can understand. And then you continue to progress through. As kids grow, you keep explaining more and more. And oftentimes they end up coming back to you with the endless flood of questions that over the age of like 4 comes into the picture. Right. And as they ask more, you get a little bit deeper in, I guess, explanation, but you do have to start at a really like dumbed down level.
Yeah. And you build on it.
Yes.
You really do. Because, I mean, even saying there's something inside of your body that makes this stuff, but it's not working anymore. I don't even know if there's context for that, really. Wait, there's stuff inside my body? You know what I mean? Like, what? Like, this is because for a young person, you're the visage that you see out front. You're not your intestines and your,
If the child is interested in books already and you read often, there are a lot of really good kid-based books that are all different levels of age to be able to start with in explanation. And I guess I would probably start there.
Yeah. And I think understanding that it's not like you're not talking to a friend. You're not going to explain it to them right now and they're just going to get it. It's going to be like a process, and you have to be patient with it. This person said, will my child live a normal life? I know the answer to that now, but I absolutely did not know then. So we covered that. This person said what you said earlier, that the simplest advice is still incredibly difficult to comprehend in the early days. It would have been great if somebody would have explained a honeymoon to me. There's one. How about this one? Will I ever sleep again? They just talked about checking every 2 hours. with no end date and did not discuss CGMs with me at the time.
And that's where, with today's technology, you as the parent or caregiver, you go back and you say, you do realize that not only have you loaded me with this thing, not you, by decision, but you've given me this thing to now help me manage for my child. You're telling me I have to do this. I know that this technology is available. You will write a prescription for this, right? I mean, you will give this to me. There is no reason not to. If I have the ability to sleep, I can make better decisions with all the things you told me to keep track of in the day for my child.
But think about what she said. Like, we're going to check every 2 hours.
There I go.
Overnight too? Yeah. Well, what?
Right.
And then
absolutely.
Then there's some doctors who used to say, don't worry, it's very important to check during the day, but overnight, don't worry about it. I was like, well, because that's what I was told. And I was like, how the hell is that reasonable?
They told you to not check overnight?
Yeah, overnight was fine. But during the day, you need to check. And I was
really?
like, yeah. And then I stopped and I didn't do that. And that's how at first I listened to them. And then eventually I was like, wait a minute, that doesn't make sense. And then, that's how I learned that I was putting Arden to bed at like 180 blood sugar. She was waking up at 90 and I thought I was doing great till I checked overnight and saw she was like 58 at some points.
Right.
And, I didn't know any of that.
Very similar to being like, your newborn baby needs to nurse every 2 to 3 hours or get a bottle every 2 to 3 hours. But at night, go ahead and sleep.
Not when you're
tired. Don't worry about it. They'll be fine until you wake up at 9 o'clock the next morning.
Yeah.
That's the same concept.
That's exactly right. And it freaked me out when I figured it out. It would have been nice, this person says, if a medical person would have just talked to me like a human being. And this next person says, the favorite thing that an endocrinologist told me early on, you see this, people say this all the time online, but there's 2 things you can no longer eat: poison and poison cupcakes is what they told me. Yeah.
Yes.
It made us realize we could do what we needed to do and succeed. The mental load of it all for me, my son was 4 at diagnosis, and I was able to work from home with him until we became more stable with our sugars. And that helped her with the mental strain, just taking another thing away in life and being able to focus more on that. We got super lucky. I was a stay-at-home dad already. So,
yeah. And I think about, especially in this, I have a number of single parents, really single, like there is no other person, father or mother, caregiver involved, and or just the sharing families, right? Sometimes you're with mom, sometimes you're with dad, sometimes you're with grandma and grandpa, or whatever it might be. And in a diagnosis setting where there really is only one caregiver, now you have added, when you talk about things changing, you've added another layer of change that they may already be pretty overwhelmed.
Yeah. Yeah, no.
So
not everybody is in my situation where I was like, oh, well, I don't have a job. I have plenty of time to figure this out. Right. I tell people all the time they thank me for the podcast. I was like, thank my wife. Like, she made enough money when we were younger that I didn't have to work. And that's part of my free time. It was around figuring out diabetes. I wouldn't call it free time like you think of, but
right.
when I wasn't
it was like you were baking cupcakes for the neighborhood, right?
I was like, oh, you know what I'll do with my free time? But I mean, I wasn't at work where I had to disconnect myself from my family's problems so I could get a thing done, so I could collect a paycheck, This person said, I needed somebody to tell me it wasn't my fault repeatedly in the beginning. Here, this is interesting. We just talked about needle fear, and so I kind of want to come back around to this for a second. This person's saying needle fear was really tough for my kid. They figured it out. It's no big deal now, etc. There's this thing that I did that I believe is worked for us, and I think it's worth people paying attention to, because in the beginning, you can do this thing where you're like, well, we'll use a numbing cream. We'll get a Buzzy. We're going to do this. We'll do that. We're going to make it easier. Oh, it's time for your shot. Not yet? Okay, buddy, let's wait. Like, I am more of the school of like, draw the insulin, stick it in, push the thing, get over with. Like, we're not going to like this one way or the other. You know what I mean?
Don't draw it out.
Let's not draw it out. I learned that lesson very early on when I think my wife and I spent an hour and a half in the middle of the night trying to get my son to swallow a pill. We just like, swallow the pill. Just take the pill. Please take the
Right.
pill. And you're like, I don't want to. Hold on. Wait a minute. Wait a minute. Wait a minute. You know, like it was that I'm just, Arden used to wait a minute. I was like, Arden, let's just do it fast and get it over with
Yep.
and just get it done. I mean, you'll find what works for you, but I think dragging it out just extends the panic because it goes away when it's over.
It does.
Yeah. You know
Absolutely.
what I mean?
It's even like an argument, with a 5-year-old, essentially. If you're having an argument and you can tell that you're continuing to get more irritated because they're just not listening to you, it's better as the adult to literally just be like, I'm stepping away. I've told you what needs to be told to you. We're not doing it for this reason. And I'm going to go over here.
Yeah.
And you can just sit because there's, so just deal with it now, get it over with and move on. You also have a lot more time in your day left.
This one person says, I was 39 when I was diagnosed, and I kept thinking, what did I do wrong? And she said, or he said, excuse me, one or the other, they said that their mental health is still not where it was before they were diagnosed. And they just don't know what to do about it. And speaking of not knowing what to do about it, this next person says, how do you deal with overwhelming emotions? I've never had them before. And now here they are. I don't know what to do. And I don't know where to get help and, the whole thing.
Yeah. I mean, the mental health piece of diabetes management, both for caregivers as well as the person living with diabetes, thankfully has gotten more attention, if you will, in the past couple of years. But I think it's still well at the bottom of pile in terms of discussion and asking, how are you doing with all of this? What kinds of things are you doing to have joy and to still feel good and to do as much as you can back to the normal, whatever normal is, right? I mean, there are quite a number of mindfulness and meditative types of things that you can kind of do to get back to letting your brain at least work through things in a way that doesn't make you continue to feel stressed all the time. But you have to look for the resources, right? Nobody hands something to you like that at diagnosis.
Right. Well, there's a question I ask a lot when I'm interviewing people and they have really heavy stories, people who are like 5, 6 medical conditions, like a lot of stuff going on, whatever. And they get done and I try to remember to say to them, hey, are you okay? Because I also try to make my interviews fun. And like, you're talking about these really serious things and trying to keep it lighthearted. And then I'm like, are you all right? I'm frequently surprised by the number of people who don't know if they're okay or not.
Or not.
They can't say. It's not that they don't want to tell you they're not okay. It's that they don't even consider if they're okay. Like, it's not a concern of theirs. I guess they compartmentalize everything to the degree where they don't ever
consider.
Yeah, at all.
Yeah.
I've had people, I'm like, just take your time. Think about it. Are you all right? They can't say, and that to me seems like emotions.
And they're not okay.
Yeah. And they're not dealt with emotions. They don't even know how to like put words to them,
Right.
It's just,
and I think some of that might come from trying to bring down emotion around diabetes management.
Yeah, make it
right.
Yep.
To be able to just see the numbers as numbers and information and be able to navigate through them and move on. Right. But a lot of that is taking a piece out that is part of being a human. And so it can go too far in terms of, I don't really even know how to analyze whether I feel good or not.
Or I don't think I should think about this because I might fall apart if I think about it.
Right.
And so everybody's just trying to, but I think you're right. Like whatever your situation is, and I'm certainly not, I mean, some people's situations are much more manageable than others, but that is your situation. It's not changing. So you have to accept it and then put your head down and keep going. And I guess maybe for some people putting their head down and keep going is, I can't think about this because I'm 39 years old and my pancreas stopped working. Are you okay? I think the answer is no, I'm not okay. This is fucking terrible. Right. And there's no the doctor said they can't fix it and it's not going to go away. So how am I supposed to be okay? And the answer is, I think you have to change your perspective about what okay is. Does
Right.
that make sense? You know what I mean?
Yes.
Because in the beginning of life, everything just feels free. You know what I mean? Like, I'm going to do
Right.
this and it's going to be fine. And if it doesn't, I'll go do something else. It doesn't matter to
Right.
me. It doesn't really hit you the first time till school when you're, if the idea of getting good grades is important to you, because then suddenly you're like, uh-oh, I'm being measured. Right.
Yes.
And then you become an adult and you get measured again because you want to stay safe and secure and fed. So you got to find a job. And then, oh, everything's not so easy. But then you fall into that and you're like, hey, all right, I'm an adult. I'm doing it. I got a place to live. Television works. You know what I mean? I got my
Right.
vitamins. I'm good. Here's the next problem. And it's medical. And then, no, it's not okay. I didn't want this to happen to me. I mean, so
Well, and medical, I think, is really, it's one that may or may not have a quick solution to it
right.
or a fix to it at all. It's something that you learn to navigate with, but it's not like, I'm not okay because my tire went flat on my car. Okay, well, this is a situational not okay. This isn't a long term. I need to learn how to accept and move forward and realize that this will be here. I know that some days are going to be great, like I want them, and other days are going to be cruddy.
Yeah.
And yeah.
I think it's important to know that you are going to go through a lot of the stages of grief, which, you can look up online. There's different doctors who think of them differently, but, shock, disbelief, denial, bargaining, guilt, anger, depression, acceptance, hope, like that stuff it's all going to hit you. And it should. This one's interesting. Do you know why they call it diabetes? Do you have any idea? I'm asking you if you know, like where the name came
It comes
from?
from diabetes in and of itself. There are several, obviously, kinds of diabetes in terms of the end. Like the diabetes we have is diabetes mellitus or mellitus or, whatever, how you say that last term. In terms of just diabetes, there are Latin terms essentially that go along with it, which is the reason for it.
This person's statement makes me think that we should call it livabetes because she said her 6-year-old said, "Why is it diabetes?" That's how the kid heard it. So she thought, I'm going to die because I got diabetes. And she's six, and
Well, it is kind of cruddy. I mean, actually, it's something my husband said to me a long time ago when we were like doing the diabetes anniversary or the diaversary or whatever. He's like, why are we not calling this livabetes? Like, you don't die right away. He's like, in fact, you move forward along with it. You're living. So what's of course, then I'm like, well, here's the Latin meaning.
Here's the Latin meaning.
Yes, exactly.
So it's, I guess Isabel did a very good job grouping these questions together for me because I just keep thinking, wow, it's amazing. They all just relate to each other as I go down the list. But now I realize she did this for me. So
did she? That was nice.
Because this next one is not pleasant, but this person said, my baby was diagnosed and everything felt like death to me. She's like, well, is sugar going to kill her? Am I going to kill her with insulin? Is this pump going to kill her? Will this CGM kill her? She said death just rang through her head in the beginning.
Yes.
There's probably a good spot here for us to point out that Jenny's living very well with diabetes, and so are a lot of other people.
Many other people absolutely are. Yes.
But we're doing this as part of this series because these are very likely the things that are going to run through your head when this all happens. And I think that should you not go find a therapist or should you not go find an online group, that it would be very helpful to know that there was another person who thought, I'm going to kill everybody. I thought I was going to kill Arden constantly in the beginning. Everything I did, I was like, this is definitely going to kill her. Like, just,
Right. I'm going to give this to her and I don't know that it's right. And I'm just going to, it's not going to end well.
Lunch wasn't lunch anymore. Lunch was just like, I wonder if I didn't screw this up is how it felt, and then, a couple of hours later, she was still looking at me. I was like, hey, yay.
This was a win. I didn't. Yeah, exactly. It is, I haven't thought about it in quite a while though the question about the word diabetes. I
Mhm.
really haven't. I mean, the first part of it has nothing to do with death at
Right.
all. Diabetes really just means a passing through or a siphoning, right?
Mhm.
And mellitus or mellitus means sweet. So they tested eons ago when we had nothing. Doctors would literally dip their fingers in like a person's urine and taste it. And if it was sweet, they knew that they had this like sugar sickness or honey sickness.
Right. And you
So
also knew your doctor really cared about you because
yes, if he's tasting my urine, well,
yeah.
urine's pretty sterile. So
Well,
unless there's like ucky, whatever.
how about I don't care, Jenny? I would not have been a good doctor in that moment. I would have been like, listen, we could taste this to see if you have diabetes, but I got to be honest, I'm not doing it. So go find a friend.
Yeah, there's lots of stuff that could be in it. And, good doctor who's like, let's taste this and see what's going on
I'm not
here.
up for that. This person said to be very careful that they stopped taking care of themselves when they were diagnosed. She said, I could start, it got to the point where I could count the times I was showering because I was just not taking care of myself anymore. She's like, I was
Mm-hmm.
fighting with my insurance company, calling companies, begging nurses to call me back. She said I was distraught and overwhelmed. And that's how the grief hit her. She kind of just started to let go of like everyday activities that she would do.
Right.
Better now.
Well, and I think it brings in, I mean, that brings in a layer in terms of what she mentioned, things like calling insurance and fighting for things, right?
Mhm.
It brings in a piece to that management that is the addition of more,
Yeah.
right? More things to keep track of and do. It's not, well, my, medication that I take for whatever it is, I pick it up once a month and it's okay. And I don't really have to think about it. I don't have to fight the insurance to cover it and whatever. But all these parts that end up coming along with diabetes management in today's world, especially, mean you may have to have more interaction at times, not necessarily every day, but more interaction at times. And especially in the very beginning, when you are asking your insurance to now, hey, cover this, and we've got this new diagnosis, and they've got all of these protocols and things that they have to follow within their organization. There's a lot of work up front.
Yeah. No, I've yelled the F word into a phone a lot of times in the beginning.
Oh, yes.
Yeah. Better.
I don't know that I've ever used
No,
that word, but
I used to find that it moved things along very nicely.
I probably said them after I was off the phone.
In 2022, I'm assuming that the customer service rep would say that they don't feel like they're in a safe space now and hang up the phone. But back then I was like, hey, you don't know how hard this is. Let's go.
Right.
This is interesting. Consequences are real, but I couldn't let that stop me from living my life. The balance. I think that not being a person with diabetes, I can't be sure, but I think that's got to be a bargain that everyone with diabetes makes every day of their life. Like
absolutely.
Right.
Absolutely. With everything. I mean, the consequences, and they're not necessarily saying the consequences are real in terms of, let's say, bad versus good. I don't love those words, but there can always be a good consequence to your choice. There could also be what you really didn't plan on happening because it just worked out the other way, right? So
this person says, the fear of complications for my daughter was my biggest worry. And that's all I saw when I looked things up online. I have to tell you, my brain works that way too. Like, you have an autoimmune disease, there's a likelihood you might have another one at some point. At what point
your brain goes to
the worst?
What else could be wrong?
Yeah, the worst.
Or what else could happen because of this?
Yeah, which, by the way, you have to guard against, because you have to make sure to look at all your possibilities as things are happening over your lifetime, but to not just see diabetes all the time too. I see people, that happens to them all the time, like, hey, my kid's got a headache. What's this got to do with diabetes? I was like, I mean, maybe the kid's just got a headache. Listen, I don't know. Is your blood sugar bouncing around all over the place? They've been low for a while or high for a while. If those things aside, people get headaches still. People with diabetes get headaches that have nothing to do with their headaches. And it's hard sometimes to separate them. you know.
And in kids, in terms of headaches, I think a big one is hydration. A lot of the time, quite
Mhm.
honestly. And yes, you might see some blood sugars that look funny too, hydration being a big piece of overall management. But headaches just alone, oftentimes it's
Yeah.
drink some water.
I want to offer some comfort to the person who wrote this because they said that they remember thinking that their son would grow up to hate them,
Oh,
because she saw what she was doing, taking care of him, as hurting him. I don't think that's how it gets remembered. You know what I mean?
no.
Yeah.
It,
I mean, I guess it could, but
it could,
well,
I think, in again, that's where some of the discussion goes along with what you're doing, using less of your own like inner thought as you work through doing an injection or changing a pump site or putting, a new sensor on or all those kinds of things that parents are doing. If you talk through it like and verbalize it rather than just think it through,
mhm.
kids absorb and they start to make connections. And with that, I would expect that the child who's hearing their parents say, we have to do this and I'm going to do this and this is why I'm doing it this way, they see it more from a standpoint of caring
Mhm.
rather than the parent like being mean.
Yeah. No, I think that hopefully over time it shakes out that way.
Yeah.
This next one, I learned the most important thing I learned from the podcast, is that non-diabetic blood sugars are actually possible. And no one told me that at first, and I did not believe it until I found the podcast. So I'm very glad that that happened for them. I guess they made it onto the Pro Tip series. But that's lovely that
It
can happen
is.
for somebody, because I do think that when expectations start getting set up and they start telling you like a 7A1C is fine, don't worry about it, you might start thinking like, oh, I guess what I used to have with my pancreas isn't going to happen anymore. But it can. Just a quick one. Lady
Yeah.
said, I was told that in the beginning it will be hard. And I thought in my mind, oh, that probably means like 2-3 weeks. And not a couple of years or
I can
however.
do this for 3 weeks.
Yeah.
I got this.
It'll
It's
be
okay.
fine. If it's only going to be 3 weeks, that'll be okay. Yeah. So there's one on here. There's one that's not on here. And I know we're kind of getting up on your time. Am I right?
But we're okay for
We're okay.
a couple minutes.
Because I'm going to tell you right now, this list goes on and on and on and on. Like, I think we've hit the big, ideas.
Big ones.
But here's one that just isn't here. And this is perspective from me, because I'm not a religious person, but I see people talking online all the time. Why did God do this to us? I see a lot. Or this is going to be okay because God wouldn't give me something I can't handle. And so I don't have a lot of religious perspective, and I understand that that's how some people might see these things, which is, I have no qualms with. But what I can see from an outsider's perspective is that sometimes I've seen people not pay as close attention to their health because they think God's got it. If
Yeah.
that's the way to put it, I don't know exactly. And if you believe in God and you think he's on your side or she's on your side or whatever you think, I'm down with that. But just remember, God is not going to bolus when your kid is 330. You need to take care of these things. There was just another story recently, I think it was from Australia, where these people were put in jail because they let their kid
They
die.
wouldn't take their.
Yeah,
Yeah.
because they said that God was going to take care of him. And,
Yeah.
This is not a commentary about religion to me. It's just you have to realize you're in a unique situation that is not going to be in any way taken care of without you facilitating it.
Correct.
Yeah.
And I think the bigger thing in whatever type of faith that you may have, most religions, most faiths have an underlying to God or logos or whatever you believe in kind of out there. It gives us movement forward in information, and the better we utilize that information for the greater good or for our own health or whatever, we have to know that that knowledge, is coming from somewhere, right? And so I don't think if there is a God, there would be, and I believe in God,
Right.
but I don't think that God dictates this person gets cancer, this person gets diabetes, this person gets heart disease. That type of being, if there is, isn't so cued into person to person. On a grander scale, we've been given free choice, right? We've been given the ability to use our brain, to use what we know how to do. Or I don't believe that there would be doctors and engineers and plumbers and people who are truck drivers or bus drivers or whatever. We've decided along a path, and we are using our brains to make decisions. And one of those things comes into health management. If you have a child or someone you love, you have to do what is been put out there already to use. Right? I mean, that's what I believe. I think in particular, from my faith base, I truly believe there was a reason that I have type 1. I believe it's because I had a destiny, if you will, to be able to use what I've been given to help other people. That's what I believe. And I don't know. So I hope I'm achieving that.
No, I appreciate your perspective very much, because I honestly don't have one. First of all, I just know that from my perspective, looking onto other people's lives, there are times that I want to respond and say, please stop hoping and bolus.
Right.
Yeah. Like,
right.
Please, I hope. Can you pray for my son? No, none of us need to pray right now. Push the button on the thing. Make the blood sugar go down. Like that kind of thing.
Right.
I just think sometimes that can get in the way of you making a good decision. And so there's a story, I'm going to get it wrong to some degree. I think it's something that's been repeated over and over again for years, but guy's walking down the street, falls in a hole. A doctor passes by, the guy shouts up, hey, can I get some help here? The doctor writes a prescription, throws it down in the hole. And the guy's like, well, what am I going to do with this? And then, a priest comes along, and he says, hey, can I get some help? And the priest writes out a prayer and throws it down in the hole. And the guy's like, I can't get out of this hole. And a friend of his walks by, and he says, hey, man, can I get some help? I'm stuck down in this hole. And the friend jumps in with him. And the guy goes, what are you doing? Like, now we're both stuck down here. And he goes, no, I've been down here before, and I know the way out.
Let me help you.
Right?
Yeah.
So you have to accept that help.
Right.
Right? You can't just step back and keep saying, like, what's the other story, right? Guy lives on a floodplain, and somebody comes by, and the news cameras come by, and they say, hey, aren't you going to leave, man? There's a flood. You got to go. And the guy's like, no. He's like, God will get me. And the guy's like, I really think you should go. They're saying you should leave here. And then a little while later, a guy comes by on a boat and says, hey, man, get in. There's a flood coming. Let me get you out of here. And the guy goes, no. Like, God's got me.
Right.
And then eventually the guy's house gets knocked over. He's dead. He looks at God when he opens his eyes. He goes, what happened? The guy's like, look, I sent the reporter with the weather reporter.
I gave you a whole bunch of help.
I sent the guy with the boat. It's an old story, obviously, but you really have to, these are just parables, because this is how people's minds work.
Correct.
Right. So take the help that's offered to you, and go to somebody who knows what they're doing.
Yeah.
Excuse me. Find people who have been through this before. Air how you feel. Don't hold your emotions in. Understand you didn't do this. Guilt is, I understand it, but try to have some long perspective. I find that what helps my guilt more than anything is sometimes when I'm talking to a person who's got autoimmune down their family line forever. The other day, this woman said to me, oh, my grandmother she's achy all the time. I don't know if she has RA. She's like, I'm not sure. But her grandmother was in her 90s. And I thought, okay, that sucks, but she still lived her whole life.
Right.
Like, you know what I mean? Like a long, long life. I think sometimes just seeing that other people do it takes away a lot of the other stuff. And I also think, Jenny, that understanding, I don't think anybody gets out of this thing unscathed. Like,
Mhm.
you know, I'm a little, maybe we all are a little jaded because we know so many people with autoimmune diseases that it feels like everyone has an autoimmune disease some days.
Right.
And I'm sure there are some people walking around who are just free and clear and nothing's ever happened to them. But I think for the most part, that's not most people. So
I don't think so either. I think most people have something that is not visible to others, similar enough to diabetes. And the only outward visual in terms of diabetes truly are the devices, right? Yeah. Now, the pumps and the CGMs that are very visible to, but even that doesn't disclose internally what the person has to go through and manage and take consideration of all day long. So yes, I loved your little boat and, you know, the news reporter and being like, hello, something's coming, right? Because that is, oftentimes if you really are hoping too much, hope is a grand thing. It's wonderful. We all have to hope for things, but along the way, we have to take action in order to get to that point of what we hoped for.
Right.
You can't just sit back in the lawn chair and be like, well, if it comes to me, great. And I really hope that it does.
Right.
That's not really going to.
You got to work towards it. Also,
you have to work.
If you've heard people on this podcast before who have multiple issues, and I'll say to them, if I gave you a magic wand and could make one of these go away, which one would it be? They almost never say diabetes. It's fascinating. Like, I always think like, oh, they're definitely going to say diabetes. They're always like, oh no, I would rather not have to deal with this. And I think my point is, even if you have one thing going on in your life and the guy across the street has one thing and you think, oh, his thing's easier than my thing. If you had his thing in 5 minutes, you'd be like, damn it.
I'll take my thing back.
Yeah, I'll take my thing back. Or how do I get rid of this now? Like, nothing, I don't know. You know, this sucks. Don't get me wrong. And diabetes is relentless and it's 24 hours and etc. But there is a way to get through it and not have to live with all these feelings. And I think in the beginning, it's hard to imagine that's true, but it really is. So,
and I think something around it too is actually opening up to the feelings in the beginning and letting yourself feel all those things, the stages of grief. Really let yourself work through that. Don't turn it off.
Right.
Let yourself work through. I feel really horrible. Could I have done something about it? No, I couldn't have changed this. Okay, let's move on. Right?
Yeah.
There's only so much that you can, or you're going to just feel bad forever. Right. And I don't want that for anybody.
There was a person here that I didn't get to that said every hospital should have a crying room. Just a soundproof room that you can go into with a chair and a box of tissues, and you can just sit there and let it out. And
a garage is a really nice place for that.
Jenny's like, I scream in the garage, in case you're wondering. All right. Well, thank you very much for doing this with me.
Of course. Absolutely. Good. Very good topic.
Good. So. I'll talk to you soon.